important things that can happen in some patients after their stroke is that they can lose the urge to empty their bladder. This is actually very important, and it happens within the first few days, and it's a little bit time sensitive. But to understand how important it is, you kind of have to understand how the body is laid out on the inside. So the human body, we each have two kidneys. And what that kidney does is that it's about the size of a fist. We have two of them, and it will filter all the blood in the body every few minutes. And in addition to cleaning the blood out, it actually balances it perfectly so that the rest of the body can use it. And the kidney will keep what it needs, and it will let go what it doesn't need by making urine. And so the kidney will make the urine, and that urine will travel down a small tube into a muscular sac called the bladder. And because we have two kidneys, we have two little tubes that will enter the bladder. And then the bladder, as it collects with urine, it will start to stretch a little bit. And once it stretches, it'll send a signal to the back of the brain saying, hey, I need to empty out. And the back of the brain will actually send a signal to the front of the brain and ask, is it okay? Meaning that, is there a toilet nearby? Can we empty out the bladder? The brain will figure out the logistics, the front of the brain, and it will send a signal to the back of the brain saying, yes, we're good to go. And then the back of the brain will send a final signal back to the bladder to kind of contract or to squeeze out the urine at that time.